Radical shifts for me are like the drivers of change, and through our work to develop the strategy, we've identified 4 areas that can really drive the change in our system and drive us in our thinking and centering health and wellbeing around people. The first driver is about leaderships and our workforce. And by workforce, I would include volunteers in that, the people that are supporting positive health creation and positive wellbeing, and the leadership that it takes sometimes and the bravery to develop new ways of working and centre things in a different way. I think the second radical shift is about resources. For me, there's something about how we understand how investment in our health and wellbeing economy is wider than our investment in the health system. So understanding that and thinking about our framework for investment and what that looks like is really important. A key driver and a radical shift that we've identified that I'm really passionate about is partnerships and collaboration. So that's not just about who we work with, but it's about how we work together and understanding the different perspectives on health and wellbeing, the wider determinants of health that are affecting people, and how we work collaboratively across the city to develop those. A really important radical shift is about monitoring and evaluating positive health and wellbeing. We need to understand what metrics really matter to people within that and centre that on our work to develop how we measure what good looks like in a way that everybody can understand and relate to. I think when we say radical shifts, sometimes that language sounds like it's fast, quick language, but I think the radical part of that, behind the drivers, is that there's a concerted effort to shift how we think and do things, and that takes time. Learning to work together in different ways and to centre our work around people is going to take some time to really deliver collectively as a city. But the radical part is the energy and the drive that puts on the system and the way we look at health and wellbeing in Sheffield.